Hello, everybody. Look, there's no question that the corona crisis and COVID 19 has changed our world, and we're in a crisis right now. Many medical practices have been closed except for emergency care, and that's appropriate. We need to channel our energy and resources to the right place. But a recent event has occurred just this past week that I think is going to ultimately change the doctor-patient relationship for the better and improve the patient experience. And it's important to be aware of it as it's just happening in real time. If we just step back and look to the world prior to March of this year, and we think about FaceTime and Skype, which most of us use in some form or another to communicate with friends or colleagues right from our medical devices. But we need to remember that medical regulations prevented doctors from using this same technology to communicate with patients. And of course, Medicare and insurance wouldn't pay for virtual visits. Well, all that changed this past week as Medicare has changed the rules, and now they are willing to pay for virtual visits. That's huge. And the right codes are there on their fact sheet, and here's the website if you need the link to go to it and be able to use this so you can expand the scope of care and be able to communicate with patients when you're in your office and they're in their home. You need, I think, to get set up now if you're a medical practice. And I understand some practices are using FaceTime and Skype, and that's okay temporarily, but that's not going to last forever. And HIPAA regulations will come back in, and you're going to need a HIPAA compliant option. And here's my checklist of what you want to look for. It needs to be simple to set up. It needs to be easy to use for your staff and your patients, or they won't use it. You need to be capable of doing video conferencing. You want to be able to do text messaging both with individual patients and on a broadcast to all your patients, and to be able to even do an easier job of referral management with other doctors. That solution is available now from Focal Point with our relationship with Luma Health. Here's just a couple little shots of what this looks like for someone receiving a message potentially from your practice, whether it's an individual patient or all patients. And here's another screen showing you what it would look like to do a video conference with the patient. So I just encourage you to look at this more closely. These things do integrate with many of the EHR systems and the practice management systems. And if you want more information, just send us an email, sm2@focalpointholdings.com. We'll get in touch with you within a few hours or the next day. You can be set up remotely and operational in 48 hours or less. We're offering a 90-day free trial. And I think that's plenty of time for you to see if this, in fact, does improve not only the patient experience, but the staff experience. And this platform sets you up for the future. That's going to be important once we get on the other side of the current crisis. I'm Sharif Madavi. Thanks so much for listening. And you can always visit our website at sm2strategic.com. All the best.